Hello, today I'm going to talk about 5 steps for you to tackle the motivational disorder in Parkinson's disease. My name is Dr. Zayas. I am a movement disorder specialist and internist. Let me start with this. It is very common to have a lack of motivation in the general population. And I think it's one of the reasons why approximately 80% of the adult population in US do not perform sufficient exercises. Although there are some improvement based on this paper published in 2018. You can see here that approximately 20% of the patients, they are not doing sufficient exercises. What they mean with sufficient exercises? Well, it is defined as at least 2.5 hours per week of moderate intensity aerobic exercise and 2 days per week of resistant weight training exercises. So in other words, this is not the same that waking up in the morning and going to the bathroom, to the kitchen, because sometimes I ask patients, are you doing exercise? And they say yes. And when you ask them, what type of exercises? Well, I'm very active. I walk a lot inside of the house. This is not what we're talking about. Let me tell you that this feeling of indifference, lack of motivation tend to be more common in patients with Parkinson's disease, and we have physiological reason for that. There are some changes in the brain circuit causing this problem. The medical term that we use for this feeling of lack of motivation is apathy. Apathy, this is the name, which is associated with depression and sleeping issues and memory issues, but not always. There are some patients that they have apathy, but they are not depressed. Step number 1, make sure your doctor or your provider evaluate for depression. If you don't treat your depression, nothing is going to get better. Remember, your body will follow your state of mind always. By the way, apathy is one of the most common non-motor symptoms in Parkinson's disease. And there are chemical reasons for that. Not only in Parkinson's disease, you have deficiency in dopamine, and that's why you have a lot of mobility issues, but also you have other chemicals in the brain affected, such as serotonin. When serotonin is low in your brain, you are more predisposed to have depression, anxiety, and this is why you should get treatment for this problem to improve your apathy, especially if the apathy is related with depression. Fortunately, we have very safe medication to treat depression. You just need to speak up and let your provider know about these feelings. This is very important. Step number 2, make sure that you are sleeping well. And sometimes you think that you are sleeping well, but you are not. If your loved one is having significant daytime sleepiness, which is common in Parkinson's disease, just having Parkinson's disease, but if you have daytime sleepiness and you are snoring at night, you need to rule out sleep apnea. Remember, sleep apnea is associated with many conditions, including heart attacks, strokes, memory issues, mood disorder, and many other problems. And it's easy to treat. Besides weight loss, there is a machine that you use. We call that the CPAP, that improve the symptoms significantly. Also, you need a good sleep hygiene, which means going to bed at the same time, waking up at the same time. Don't change that. the body doesn't work like that, and especially in the setting of Parkinson's disease, that you need to have a structure, or otherwise things are not going to work well. I have a full video about insomnia in the setting of Parkinson's disease. Step number 3. Before blaming Parkinson as a cause of your problem, make sure that you are not having other issues such as metabolic process abnormalities, especially thyroid dysfunction. It's very important to check what we call the TSH, because when you have what we call hypothyroidism, so low levels of thyroid in your blood, you might have a lot of symptoms similar to a patient with apathy, such as fatigue, tiredness, cold intolerance, depression, constipation, and muscle pain. So it's very important you tell your doctors all these symptoms, because your doctor most likely will order these tests in order to rule out these common problems, which tend to get more common when you get older. Step number 4, change your habits. You need to have a schedule. This is how the things work in Parkinson's disease. You need to have a structure. Otherwise, things are not going to work well. Sometimes you need to have a body to perform your activities. Some people get a dog, and having a dog is a good thing. Sign up. So when you sign up to a class, you have the pressure to go. So people are waiting for you. So usually you go when you sign up. Try to do that. Other thing that you can do is to have measurable goals. And it's not just doing 5 minutes of walking, 10 minutes of walking. No, just try to measure how long take you to walk 1 mile, and try to improve that goal. When you reach your goal, you feel good and you will continue doing it. This is how the brain, your mind works. I always tend to advise to do exercises in the morning. And why is that? Because usually you have more energy in the morning. Not always, everybody's different, but try this. Try to do your physical activities early in the morning when you wake up, and try not to do the same thing over and over every day in terms of exercises. So try to select 3 activities. If you like to play golf, play golf in the morning, and the next day you walk, and the next day you swim. So try to combine these type of activities, but try to follow the schedule. Okay, don't change that. That's the most important thing. Remember, having a schedule exercise program improve apathy. There are plenty of research about this. Step number 5. Let me make things clear first. There is no guideline for the management of apathy in patient with Parkinson's disease. The evidence is very conflicting. The improvement of medications reported in many studies might be due to the treatment associated with depression and or cognitive impairment, memory, thinking impairment. Okay, so this is what we have available. Number 1, some people use what we call rivastigmine, which is the Exelon. Comes in a patch or a pill. And actually, this is the only intervention recommended by the Movement Disorder Society evidence review with efficacy. This was published in 2019. The other medication that we have available that might help, even the data is not too clear, is the use of rotigotine or Nupro patch. So just be aware that the side effect of using dopamine agonist like rotigotine, one of the most common one and not good at all, is having compulsive disorder. So be aware of that. And actually, dopamine agonists might cause sleep attacks. So be careful with that. Also remember that if you have depression, you need to treat your depression. Otherwise, things are not going to get better. It doesn't matter what you do. I typically use these three type of antidepressant, which tend to be very, very, very safe. People tolerate the medication pretty well, especially the last two. Even though that the Movement Disorder Society recommend more the use of venlafaxine in the setting of Parkinson's disease because of the data available. Always try to treat your depression, and always start with the lowest dose possible. Okay, very important. If you like this video, don't forget to subscribe to my channel. See you soon.